So Bernie Sanders appeared on CNN, and I think you already know how this segment is going to go. The subject of Medicare for All came up, the CNN host concern trolled and fear-mongered about some aspects of Medicare for All. Bernie then had to respond. And, this is why I get so frustrated with these types of segments. If you are a news host, your one job is to educate people. You're not, pontificating about what you think will happen under Medicare for All. Your job is to do the research, put in the time to learn about it, and then educate your viewers, not fearmonger based off of a misunderstanding of Medicare for All. But that's not the real world here, so, we instead get a segment like this.
Medicare for All. There's a new poll out that I'm sure you've seen just yesterday, an NPR Marist poll. It just asked Americans a simple question. Do you think Medicare for All is a good or bad idea? 41%, only 41% said it's a good idea. 54% said it's a bad idea. 39% of independents only like it. And even 3 in 10 self-identified Democrats are skeptical. Why?
No,
Why
I don't
is
think.
It, why
well,
is
first
it the
of all,
best plan
hold
for
it,
America
hold
when
it.
a majority... Hold on, I asked the questions here. When a majority of Americans aren't behind it.
Well, obviously, you saw the poll that came out from the New York Times 2 days ago, in which 78% of Democrats thought that Medicare for All was a good idea, and 69% of independents thought it was a good idea. Medicare for All, depending on the wording of the poll, does very, very well. And the answer why it does well is the American people are sick and tired of a dysfunctional healthcare system in which over 80 million Americans are uninsured or underinsured, and we are spending almost twice as much per capita on healthcare as do the people of any other country. The American people are sick and tired of seeing insurance companies become rich while they can't afford the healthcare that they need.
So let's talk about this a little bit more and what it would mean for the average American. You were on Fox News Sunday back in June with Chris Wallace. It was a fascinating interview. This is part of it that really struck me about whether Americans could keep their doctors, their hospitals exactly as they have them now under a Medicare for All plan. Here you were.
What we are talking about, despite a lot of misinformation coming from the insurance companies and the drug companies, is allowing all of the American people to continue to go to the doctor that you want to go to the hospital that you want to go to.
I really like my doctor, and I'd like to keep going to her. But what if she decides, Senator, that a Medicare for All plan doesn't pay her out enough, and she's going to just take private patients that I would have to pay out of pocket to go to her? And that's okay for me, because I can afford to. But it's not okay for most Americans. Could they still keep their doctor if their doctor decided these rates aren't enough for me?
That is not the way the system is going to work. The system is going to work similar to what exists in Canada. And what we are going to see is an expansion of Medicare, where almost all doctors are now in Medicare, to cover every man, woman, and child in this country. What we are talking about is a 4-year transition period. Right now, as you know, eligibility for Medicare is 65. We take it down at the end of the first year to 55, next year 45, next year 35, and then we cover every man, woman, and child. And by the way, what we also do is expand Medicare coverage for seniors to include dental care, hearing aids, and eyeglasses, which are not currently covered by Medicare.
That matters. But I'm just asking you, the fact of the matter is that not all doctors take that, because they don't all like the rates that they're paid. So can you 100% guarantee to all Americans that their existing doctor would see them under this plan and they would not have to pay out of pocket a private rate?
But as you well know, right now, all Americans cannot go to the doctor that they want within their own insurance program.
And I think the system is broken and it needs to be fixed some way. But you said earlier this summer that people could essentially keep their doctors in their hospitals. And I'm just wondering, is that 100% true for every American?
Well, under Medicare for All, as I said on that show, every American will be able to go to the doctor they want because doctors will be in the Medicare for All single-payer program, as they are right now in the Medicare program. Look, the time is overdue, it seems to me, to end a dysfunctional system which enriches the drug companies and the insurance companies, and do what every other major country on earth does. Guarantee health care to all people, freedom of choice with regard to the doctor and the hospital, and at the end of the day, we will save the average American considerable sums of money on the amount of he or she has to spend on health care.
So, of course, she starts the segment by citing one poll that shows Medicare for All isn't as popular as us progressives are saying it is. Interesting. So rather than looking at aggregate polling data, which shows that Medicare for All is in fact popular, you cherry pick one poll that proves your point? Seriously? I wonder why she did that. It's almost like corporate media has a pro-corporate bias or something like that. So this is what I really wanted to talk about with regard to this segment. The host is just completely misinformed about Medicare for All. And I get it, like this is relatively complex. When you start really digging in, some of these details are a little bit confusing. So I would expect John from Ohio to not really know about the fundamentals of Medicare for All and what it would look like in practice. But I do expect a CNN host to know about this. And the question she asked demonstrated that she has no idea. So let me read back to you what she said. I really like my doctor and I'd like to keep going to her. But what if she decides, Senator, that a Medicare for All plan just doesn't pay her out enough and she's going to just take private patients? I would have to pay out of pocket to go to her, and that's okay for me because I can afford to, but it's not okay for most Americans. Now, what I don't like is that she kind of cloaked this question in what is ostensibly a concern for the average person who can't afford to pay out of pocket. That's bullshit. Because if you truly care about average Americans, then you should be backing Medicare for All vociferously and passionately and not spreading misinformation about it based on your uninformed opinion. So Bernie Sanders said that is not the way the system is going to work. And he's correct. Like, your doctor cannot say, well, you know what, Medicare for All isn't paying out enough, so I'm just going to practice privately. I mean, sure, your doctor can technically do that. However, the thing about Medicare for All is that it bans duplicative coverage, meaning a private insurance company cannot offer what is covered under Medicare for All. And Medicare for All covers pretty much everything. So if your doctor wanted to hypothetically practice privately, she would basically go out of business if she says, I am not going to accept Medicare. I will only accept private insurance, because under a Medicare for All system where everything is covered and duplicative care is banned, well, then there won't be private insurance. Basically, people would have to go to her only if they were willing to subvert Medicare and pay out of pocket for literally everything, which wouldn't make sense because who would want to do that? So she has no choice. She'd have to accept Medicare. Otherwise, she wouldn't be able to be a doctor. And it is absolutely essential that we do get rid of private insurance so we don't set up a two-tiered healthcare system like the one that this CNN host is kind of alluding to. So, I mean, your doctor isn't going to want to do this unless she wants to go out of business. Do you understand? Like, if you're a doctor, like, you're going to have no choice. You will have to accept Medicare for All. Otherwise, good luck finding people who's just going to pay like $1,000 for a particular procedure that they need. Because again, that's not covered under private insurance. So the question was bad. Bernie Sanders was right to say, I don't think you understand how it works. Or he said that's not the way the system is going to work. With that being said, Bernie Sanders did not do a good job at explaining this. And I think it was because the question was so bad that he just thought, oh, well, I have to explain the transition period. No, Bernie, she really needs to be educated about what it would look like under Medicare for All. And he did not do a good job at laying this out. And that's disappointing because Bernie Sanders usually, he knows his shit about Medicare for All, and he's usually great, but he wasn't on his game here. I've got to admit, he wasn't on his game, and that pains me to say because I love Bernie Sanders, obviously, but, I think that you've got to start looking at this particular smear with regard to Medicare for All because it's come up before. Michael Bennet, for example, who's another presidential candidate who's against Medicare for All, he's also been fear-mongering about this aspect of Medicare for All. He says, look, if you pass Medicare for All, hospitals are going to go out of business because, Medicare just doesn't pay out enough in comparison with private health insurance companies, which is why we need a multi-payer system as opposed to a single-payer system. Now, is there going to be a shortage of hospitals under a Medicare for All system? I don't know. Why don't you talk to a Canadian and see if they have a problem getting into hospitals? Talk to a Canadian. They're going to say, no, you guys are still buying this propaganda that is being peddled by insurance companies, really? And one thing that these people who are making this argument leave out is that moving to a single-payer system is going to drastically simplify our healthcare system. It's going to reduce administrative costs overall, which will then allow some of these hospitals to absorb lower payouts because they're not going to need a bunch of lawyers and clerks for all this paperwork. And furthermore, there's no longer going to be unpaid medical bills because if the government is going to pick up the check, then it's always going to be paid. Like, for example, if you have a surgery that costs $50,000 and your insurance is only paying for half of that, then the hospital is going to be owed $25,000. Now, under our current system, that hospital is going to struggle to get that money. Maybe you're going to have to get on a payment plan. Under Medicare for All, it's paid for. So the issue isn't really going to be as big of a problem as people are making it. But a lot of people are basing this off of that Mercatus Center study where Charles Blahous found, unfortunately for him, that Medicare for All would actually save the American people $2 trillion. Now, in addition to that finding, which he kind of tried to bury, he also claimed that if we do Medicare for All, that would result in hospitals being paid 40% less than they're currently being paid under our system where private health insurance companies are paying out presumably 100%. But the problem is that that study is biased. It was funded by the Koch brothers, and it was useful to show how even your own libertarian-funded study doesn't prove that Medicare for All is as bad as you think it is, but it's still biased. So he says 40% cut. But what is it going to be in actuality? Well, according to the People's Policy Project, the cuts will be 11%, and according to the Urban Institute, which is a centrist think tank, no fan of Medicare for All, that predicts that there will only be a 13% cut in payouts to hospitals. In other words, nowhere near the 40% cut that Charles Blahous was trying to fearmonger about. So, do you think that these hospitals will be able to absorb a 11 to 13% cut in payouts after saving money on administrative costs and getting all the medical bills paid for by the government? Yeah, I think so. But let's go to the specifics because Jeff Stein of the Washington Post did a great job at explaining what this will look like in practice. He reports Matt Brunig of the People's Policy Project notes one key selling point of a single-payer system is it spares physicians the reams of paperwork they have to do under the current system for private insurance companies. If America's physicians could reduce their administrative costs to Canadian levels, he said, healthcare spending would fall by well over 11%. Canada has a single-payer health system. The overhead costs here are substantially low because you don't have to hire administrative clerks and billing experts to chase after money, said Daniel Martin, a Toronto Women's College hospital physician who supports Sanders' legislation. What matters to people is their net income, not their reimbursement rates. Then there are the doctors and physicians whose reimbursements would go up under single payer. Richard Bruno, a doctor in East Baltimore who primarily sees low-income Medicaid patients, said low reimbursement rates make it difficult for his clinic to purchase the equipment he needs, like replacement microscopes. We could do so much with higher levels of Medicaid reimbursements, said Bruno, 38. We'd be able to explore much better models for providing care. But to other experts, even an 11% cut in provider rates could present serious challenges for private hospitals and physician practices operating on tight margins. A number of prestigious hospitals, such as New York University, the Stanford University Medical Center, and the Ronald Reagan UCLA Medical Center, are especially reliant on patients with private health care and would likely see average cuts bigger than 11%, according to Larry Levitt, a healthcare expert at the Kaiser Family Foundation. So there's a lot there just within those couple of paragraphs, but to put it simply, if we pay out less, if we pay out 11% less, 11% less than we are paying out now to all hospitals under Medicare for All, Well, still, there will be a savings under Medicare for All greater than 11%, meaning they'll actually get more money in most instances, but not all instances, to be fair. As this article stated, there are certain hospitals who currently rely disproportionately on private patients who would, unfortunately, have to tighten their belts. But let's just for a minute catastrophize and think of the worst case scenario. Let's say that CNN host goes to the Stanford University Medical Center and her doctor works there. Now, let's say that it becomes so bad that the payouts become such an issue that they're forced to close shop, and then that CNN host's doctor goes on to work at a different facility. Then what? Well, under a Medicare for All system, there are no networks and your coverage is universal, meaning you would be able to still see your doctor at whatever facility or hospital she lands at. So even under the worst case scenario, it's still much, much better than what we currently have. And it's not even debatable at all. And if you still think, well, look, I just don't think that there should be any cuts to hospitals, period. Okay, that's fine. But you just need to admit and be upfront about the fact that you care more about the profits of hospitals than you do about people actually receiving the care that they need. Just admit it. Because there's not going to be this disaster scenario where there's this shortage of hospitals, as, people like Michael Bennett and this CNN host probably want you to believe. Because single-payer systems, they exist in other countries, and that hasn't happened. There's a reason why, once you go single-payer or some type of nationalized universal healthcare system, you don't go back. No country has ever reverted back to a private system after going to a public system. And really, if these hospitals want to complain, then if I were Bernie, I would say, okay, well, if you don't like that you're going to be paid out less under Medicare for All, how about this? We'll just nationalize you. Because currently it's the case that these facilities will be able to operate privately under Medicare for All because the government is not nationalizing hospitals and taking over hospitals. It's just being the single payer and paying the medical bills of everyone. But if you want to fuck around and start complaining, we can talk about nationalization. We can talk about a national health system, which is what Great Britain has, where most hospitals are just publicly owned and operated. We can start having that conversation if certain greedy hospitals want to start buying off politicians like Joe Biden and Michael Bennett, which they have. But I mean, this is a very simple question. Do you believe that people who don't have insurance or healthcare should die if they don't have insurance or healthcare? If the answer is no, then you support Medicare for All. It's very simple. You can draw a straight line from Medicare for All to the total elimination of medical bankruptcies and deaths due to a lack of healthcare. So if you support ending deaths due to a lack of health insurance, then you have to support Medicare for All. Otherwise, you're full of shit. Now, you can come up with some alternative, Medicare for America, Medicare for All who want it, but know that you're full of shit. We know that you're trying to utilize the popularity of Medicare for All by using the word Medicare in your shitty program, which is just a multi-payer system, but that's not going to solve the problem. If you want healthcare to be about healthcare exclusively, you eliminate that profit motive. Period. So I shouldn't have to be explaining this. A CNN host should automatically know about the details, because if you're going to plan on pushing back against Bernie Sanders and challenging him on this, which you should, I mean, no candidate is above criticism, then you at least have to know the details. And I get that this is very complex and you're dealing with a bunch of different issues, but you've got to know this stuff. Otherwise, you don't get to challenge him on this. You don't get to say, well, Bernie, your plan will do this, when it won't do that in actuality. You could have read the Washington Post study that I cited. You could have taken 5 minutes out of your day to educate yourself before interviewing Bernie Sanders here. But you didn't do that. And I'm not going to pick on just this one host, because everyone in mainstream media is doing that. It's not because they're genuinely concerned about Medicare for All. They're not fear-mongering out of a general fear, or a genuine fear more specifically. They're doing what CNN's health industry corporate advertisers want. Pushing propaganda and spreading misinformation at the behest of the industry that benefits from defeating Medicare for All. It's really that simple. Occam's razor.
Mike is a total loser, so don't hit the subscribe button, okay? And whatever you do, folks, do not hit the notification bell either. Mike treats me so unfairly.